60 million Americans live in rural communities where hospitals are closing, providers are disappearing, and children are dying by suicide at higher rates than from any other cause. Congress has put $50 billion on the table over the next 5 years to change this. The question is no longer whether rural healthcare can be transformed. The question is whether the people making decisions will choose proven solutions over pilot promises. In East Carroll Parish, Louisiana, the median household income is $28,321. 1 in 5 residents has diabetes. Nearly half have high blood pressure. 93% of the state's population lives in a designated mental health shortage area. Only 1 in 20 people in Louisiana struggling with substance use disorder receives any form of treatment. If you live in East Carroll Parish and your doctor orders a blood pressure medication, a $10 copay is not a minor inconvenience. It's a calculation against groceries, gasoline, or keeping the lights on. For families living paycheck to paycheck in communities like these, and there are millions of them from the Mississippi Delta to the Appalachian Hollows to the Great Plains, the American healthcare system is not broken in some abstract policy seminar sense. It is broken in the way that kills people quietly, one deferred appointment and one unfilled prescription at a time. This is the landscape into which the Rural Health Transformation Program was born. Authorized by federal law and launched on July 4, 2025, RHT represents the largest federal investment in rural healthcare in American history. $50 billion over 5 years distributed to all 50 states through cooperative agreements. First-year awards are announced on December 29, 2025. Every state applied, every state received funding. The starting gun has been fired, and yet only weeks into the program, the dominant conversation is skepticism. Critics say the dollars are too small to offset cuts, too short to fix decades of underinvestment, too fragmented to save every rural hospital at risk. The skeptics are not wrong about the math. They are wrong about the question. The right question is, what care delivery model can actually reach 60 million rural Americans within a 5-year program window at a scale and speed that justifies $50 billion in public investment? The states that succeed will be the ones that deploy what we call virtual whole person care, not as a technology overlay on a broken system, but as a fundamentally new category of care delivery that operates alongside insurance rather than through it. I have spent the last 20 years in healthcare innovation, and I've watched more policy programs launch with fanfare and die with a whimper than I care to count. What makes RHT different is not the money, though the money is unprecedented. What makes it different is the accountability structure. CMS will measure, CMS will score, CMS will reallocate. The states that perform will be rewarded. The states that do not will watch their funding flow away from them. This is not a grant to be managed, it is a grant to be executed. To governors, you have right now the largest single investment in rural healthcare your state has ever received. Your legacy on this issue will be determined in the next 18 months, not by what you announce, but by what you deploy. Choose proven solutions over pilot promises. Demand measurable outcomes within year 1. Build procurement pathways that reward speed and accountability. And understand that the communities you serve cannot afford another well-intentioned program that takes 3 years to deliver its first appointment. To rural hospital CEOs, RHT will not save your hospital in its current form. That is not what the program was designed to do. But it can transform your hospital into the anchor of a regional care network that is sustainable, connected, and capable of delivering outcomes that value-based payers will reward. The 74% of your peers who identify limited internal capacity as their greatest threat are telling you something important: you cannot do this alone. Virtual whole person care platforms provide the clinical bandwidth, the technology infrastructure, and the population health analytics your facility needs to survive the transition from volume to value. To the 60 million Americans in rural communities, you have been promised transformation before. You have watched programs come and go while your hospitals closed, your providers left, and your children's mental health crises were met with emergency departments instead of a treatment. This time, the structure is different. The funding is real. The accountability is built in. but the outcomes still depend on whether the decision makers in your state choose to deploy care that reaches you where you are or spend 5 years building infrastructure that arrives too late. The healthcare system that failed rural America was not built by malicious actors. It was built by a model that assumed proximity to providers, ability to pay cost sharing, and access to technology that rural communities do not have. RHT does not ask states to fix that model. It asks them to replace it with something better. Virtual whole person care, always on, zero patient cost, and integrated across primary care, behavioral health, and pharmacy, deployed through an easy-to-use digital app or through a simple phone call. This is not a vendor pitch. It's what Revive Health already delivers for millions of rural Americans. Our core capabilities are the logical solution, allowing for rapid, high-quality deployment that will meet the need for 60 million Americans who experts believe have been waiting long enough. The clock started on December 29, 2025. CMS is watching. The performance review is in September. The residents of East Carroll Parish, Louisiana, and their counterparts in every rural county in America are not asking for another white paper, another advisory committee, or another 5-year strategic plan. They are asking for care today at a price they can afford from a provider they can reach. We are committed to helping you give that to them. At Revive Health, we are on a mission to make whole person care always affordable, always accessible, and always awesome. We do this today for 5 million plus members. Our teams are ready to work with you and your local hospitals, clinics, and providers to change the way your residents experience healthcare. If you are responsible for shaping your state's rural health transformation strategy, we welcome the opportunity to meet with you, share what is already working at scale, and explore how integrated virtual whole person care can help your state turn this historic investment into measurable outcomes for the people who need it most.